All right. Let's see, it's still Monday for me, so I'll get this posted on Tuesday. But so far, we've kind of gone through most of the anatomy. I mean, we've gone from the external areas to the alveoli. That's kind of it for the parts. After the alveoli, everything else will be circulatory system again. But there's a couple other bits we need to talk about structure-wise. So what we're going to do now is what you could call pulmonary breathing, or the mechanics of ventilation. That is physically, how do you get the air into and out of your lungs? It's not a big deal, but we know your breathing pattern isn't always the same. When you're sitting there laying on the couch or something, breathe pretty slow, pretty shallow. But then if you get up and exercise, you breathe a lot deeper, you breathe a lot faster. Of course, breathing, one of the things it's going to do is match the demands of your body, controlling CO2 and oxygen levels based on need. So it isn't set. Now, as we'll see eventually, there are mechanisms in the nervous system. Of course, the nervous system controls the muscles. So there are sensory neurons monitoring carbon dioxide levels in the blood, oxygen levels to some degree, pH of the blood. That's the information the brain uses to control your breathing pattern. But we know it changes. So what we're going to look at now is kind of the muscles. What do you use to inhale and exhale? And there are different sort of situations. So I'll just use kind of the two extremes. We'll look at ventilation at rest. When you're just sitting there, not doing much of anything, demand is low, metabolism is low, ventilation's fairly slow, fairly shallow. But then, during periods of high oxygen demand, what we call work, your ventilation changes. It's much faster, more rapid, deeper. So we'll look at ventilation under two conditions. I'll just use rest and rest. We'll have inspiration breathing in, and expiration. Or out, in, to keep it simple. All right, so during periods of low oxygen demand, at rest, your primary respiratory muscle is the diaphragm. You can imagine, I'll kind of draw it here as your rib cage. I'll show you a little prettier picture in a bit. Here's your diaphragm on the bottom, and your lungs come in. There's your lung. I just drew one. All right, what happens, the diaphragm is that dome-shaped sheet of skeletal muscle, and when it receives a nerve impulse from the phrenic nerve is what innervates it, the muscle fibers on its diaphragm contract, and it basically pushes down. It's like the plunger of a syringe, basically. You can imagine your chest is like the syringe body. The diaphragm is like the plunger. When it contracts, it pushes down. What does it do when this goes down? The volume of your chest goes up. So when the diaphragm goes down, you got a bigger volume. Again, with Boyle's law, if the volume goes up, what happens to the pressure? It drops. So when that diaphragm contracts, if you were monitoring the pressure in the chest, it's going to be lower than atmospheric. If atmospheric is 760, when a diaphragm contracts, you might go to 756 or something, a few millimeters of mercury lower. Gases will go from an area of high pressure to low. So the atmosphere has more pressure, it'll push the air in the trachea and the airways and fill up the lung till the pressure's equilibrated. So inspiration at rest. We'll use the diaphragm. Now, I get the air in. How do you get the air out? Well, remember the lung, it's elastic. You can model it like a balloon. If you take a balloon, you blow it up. How do you get the air out of a balloon? You just let go, and all the air blows out, right? It's kind of the same with the lungs. During rest, there are no muscles used to force the air out. What forces the air out, just like in a balloon, is, we'll call it elastic recoil. And you can do this with a lung that's even out of the chest. Blow it up, take the trachea away, and it'll deflate itself. So elastic recoil is passive, no muscles involved. Most of the elastic recoil, though, some of it is the elastic tissue in the lungs itself. And there are some elastic components of the thoracic cage itself. Another component of elastic recoil, though, is surface tension. Remember that fluid in the alveoli? The surfactant reduces the surface tension. It doesn't eliminate it. So for elastic recoil, about 1/3 of the force is due to elastic tissue, elastic components in the chest, the lungs itself. A good chunk of it, though, about 2/3, is due to surface. Surface tension. That's all passive, though. That's elastic recoil. Now, what happens when you need to increase oxygen demand? What I'll call, because it's easier to write, work. When oxygen demand goes up, you need to move more air quickly. So, for inspiration during periods of high oxygen demand, you will still use the diaphragm. So basically, for inspiration, always put down diaphragm, and you'll be correct. But you'll recruit additional muscles. Now, there's a number of different muscles you'll use, but the main one, external intercostal muscles. They're the ones you've looked at them last semester, this semester, I think. They're kind of between the ribs. And the ribs are kind of like bucket handles. They articulate with the sternum and the vertebral column, but they lift up and down. When the external intercostal muscles contract, they actually take the ribs and lift them up. Well, when the ribs lift up, they push out the sternum. So the external intercostals will increase sort of the diameter or circumference of the chest. It moves out this way. You can watch someone with a breathing arch. The chest gets big. So the diaphragm kind of increases the length of the chest, and the external intercostals the width or the circumference. Both of those act to increase the volume, drop the pressure, even more air is pulled in. So this is what you use when you're exercising, working. Now there are some other muscles, I'm not going to list them, but your sternocleidomastoid, it's attached to the sternum, clavicle and mastoid process. Because it's attached to the sternum, when you're really puffing, moving a lot of air, that will actually lift up a little bit as well. I think some of the other muscles associated with the rib cage you might have looked at last semester, they can play some roles as well because they'll move the ribs. But these are the main two. So these are the ones I'll ask you about. Inspiration during periods of high oxygen demand, diaphragm, external intercostals. Now, what about expiration? All right, elastic recoil, passively getting rid of the air, that's not fast enough. It would just go, you want to push it out quick so you can suck in another breath. So you will recruit muscles for expiration when you're working. The muscles you will use, of course, one of them would be the internal. Internal intercostals. They are just antagonistic to the external intercostals. So the external intercostals push the ribs up, increase the volume of the chest. When you exhale, the internal intercostals just push the ribs back down, push the sternum in, and kind of squeeze on the lungs, kind of like squeezing on a balloon or something to get the air out faster. So those are for expiration at work. Elastic recoil is not sufficient. And we'll also use the abdominal muscles. Now they're down here. What do they have to do with the lungs? You know, the ones you looked at last semester, abdominis rectus, internal, external obliques, all those are your abdominal muscles. They're not attached, up here. How do they help with the lungs? Well, if you think about it, when the diaphragm contracts, what's underneath it? You got the liver, the stomach, all your intestines. That's getting kind of smushed down this way. The abdominal muscles, when they contract, it's almost like your guts or Play-Doh. You squish it down, it gets short and fat. When the abdominal muscles constrict, they squeeze on your viscera, on your guts, and they actually cram that stuff back up against the diaphragm and push it up. So they're kind of working antagonistic to the diaphragm. They're not connected the same way, but they squeeze on the abdominal organs, push them all up, push that diaphragm up, force the air out faster. So those are the two sets of muscles I'll list or ask you about for expiration during periods of high oxygen demand. So just make a quick list. Moving the air at rest, diaphragm for inspiration, elastic recoil for expiration. At work, diaphragm, external intercostals for inspiration, internal intercostals, and the abdominal muscles for expiration. And next, I'll just show a little prettier picture than this, and that's all we'll need for mechanics of breathing. All right, this is just a prettier picture than the one I used. What they're showing you up here, here's the diaphragm. This is the lungs. We're not showing you much of the rib cage or intercostal muscles here. Trachea coming down. All right, this is showing you the diaphragm relax. Kind of look at the height here of the thoracic cavity, and then what they're trying to indicate. When the diaphragm goes down, the volume here increases, and of course, when this volume increases, the pressure will be lower in here, than it is out in the atmosphere, so the air will just rush in. Then, when you just relax the diaphragm, elastic recoil will cause the lungs to push. Pretty much the elastic tissue will recoil, as the name implies, push on this gas, increase the pressure a bit, and the air will go out. Intercostal muscles, same thing. They'd be right around here. When they contract, it kind of increases the width or circumference of the chest, again, increasing the volume more. Air will rush in, and you inhale. And then for expiration at work, the internal intercostals will contract, pushing the sternum in and squeezing the air out. And then the abdominal muscles will push all the visceral organs up against the diaphragm, pushing it up, again, forcing the air out. So this is just a little prettier diagram of diaphragm relaxed, contracted. They're not really showing the intercostal muscles well, but they'd be along the rib cage here. All right, take care.